Welcome to the Knowledge Seeker channel. The channel is dedicated to exploring critical issues in the world. As such, this channel is not afraid to challenge existing facts, beliefs, and practices in order to contribute to the advancement of knowledge. This presentation is titled Health Science and Food, Contradictions and Confusion, a critical review. The purpose of this presentation is to accomplish two goals. One, explore the relationship between health science and food. Two, identify the contradictions and confusion emanating from health and medical sciences' effort to standardize, quantify, measure, test, and determine the best foods for good health. Please take note, this presentation is merely for educational purposes only and should not be taken as a substitute for professional medical consultation and advice. Please always consult your healthcare specialist, medical doctor for any medical situation for a professional advice. Now, let's see the difference between health science and medicine or medical science. In other words, people tend to mix both health science and medical science together. However, they are two different fields but related. So let's look at the difference between them. It is necessary to know that there is a difference between health science and medical science. Health science focuses on wellness promotion, public health, and healthcare management. This emphasizes preventive health care. On the other hand, medical science concentrates on studying diseases, diagnostics, and treatment development. It takes more years of medical training to receive a degree in medicine. Note, even though there are differences between the two fields, however, since both fields are geared toward improving health, they are treated here as being synonymous in the sense that both health scientists and medical scientists advise their clients, patients to eat foods that are likely to improve their health. So regardless whether you talk about health scientist or medical doctor, both will always tell their patients to eat food or good food that will improve their health. Indeed, both health scientists and medical scientists counsel their clients about the relationship between food and good health. To accomplish the goals of the presentation, the following arguments are made. 1. In compliance with the scientific methodology, health medical science is limited to the study and application of physical, tangible, material quality of human beings and other animals. 2. The effort to standardize, quantify, test, and measure in order to show correlation or relationship between food and good health are incompatible with the order of the natural world. 3. Suggestions by health and medical scientists on foods that contribute to good health are contradictory and confusing. 4. In particular, the specialized nature of medicine contributes to the contradiction and confusion concerning what food is good for good health and what is bad for health. 5. Scientific reasoning based on logic about the relationship between types of foods that are likely to contribute to good health fails to take into consideration the fact that nature is much more complex than human reasoning. And 6, indeed, food is medicine, but more work needs to be done by the health professionals to tidy up their understanding of food and good health. Now, to go further, let's see what is science. Since both health science and medical science are part of the scientific methodology. Before embarking on the discussion of the topic, it is necessary to know what is science. Science can be defined as the study of the structure, characteristics, and behavior of the physical, natural, and social world through systematic investigation, observation, and experimentation. It is a process or a means to understand how the natural world works. Thus, scientific knowledge can only be acquired through systematic gathering, classification, and interpretation of data that have been carefully investigated, observed, and experimented upon. The process includes making observations, forming logical hypotheses, and testing them. The implication is that any knowledge gained without the rigorous application of systematic investigation, observation, and experimentation will not qualify as scientific knowledge. Scientists tend to characterize such knowledge as a myth or legend or folk tale. Thus, medical science is evidence-based like other sciences. Now, let's look at the different types of science. There are different categories of science or different fields of science. 1, you have natural science. So natural science will include physics, chemistry, biology, and earth science. 2, formal science. That includes mathematics, logic, and computer. 3, social sciences includes anthropology, archaeology, psychology, sociology, political science, and economics. 4, applied sciences. That include engineering, health, and medicine. So the topic of this discussion today comes under applied sciences. Note, each of these branches has many subfields. So for each of these branches of science, there are so many subfields. Hence, there are so many branches of specialization in the sciences. As can be seen above, health science and medicine are part of applied science. They are applied because, apart from theoretical postulations, they offer direct practical services to people and animals to prevent or alleviate medical inflammations and other conditions caused by sickness or disease. Now, to go further, let's briefly look at how modern scientific medicine has been so successful in changing the human life situation. There is no doubt that health and medical sciences have contributed immensely to enhancing the quality of life by eradicating conditions that lead to inflammation and other diseases which afflict human beings and other animals. In fact, due to the advancement in health science and medicine, people now live longer compared to 200 or 300 years ago. As a result, the death rate has reduced because of the wonders of modern scientific medicine. Thus, no day passes without a new medical discoveries being made somewhere in the world to enhance medical treatment. Similarly, new medical technologies are being invented to make medical treatment less intrusive and painful. Hence, some surgical procedures can be carried out without even intruding into the human body. Some surgical procedures, like colonoscopy, can be completed within an hour without the patient feeling any pain. Likewise, some drugs have done wonders to improve human health. These achievements cannot be denied at all. Science has contributed immensely to improving human life. However, the scientific methodology also has some weaknesses, limitations. Here I call it the weaknesses, limitations of health and medical sciences. Despite the great achievement in health and medical sciences, there are drawbacks concerning the relationship between food and good health. In this section, specific problems are associated with health and medical sciences concerning the relationship between food and good health are identified and discussed. So please follow me as I go step by step in identifying them. 1. The relationship between food and good health. One area of health and medical fields that science has not been able to master or develop proficiency is determining the relationship between food and good health. In short, medical scientists seem to struggle in being able to connect food with good health. Due to the difficulty, they offer contradictory and confusing suggestions about what food to eat and what food not to eat in order to avoid certain inflammatory conditions. As a result, patients are left to wonder about what to eat or not to eat sometimes. The confusion is mostly experienced by those who have diabetes, high blood pressure, cancer, kidney, and liver diseases. In fact, one could even include heart problems also. This leaves patients totally confused on what to eat and what not to eat. Confused by the contradictory suggestions, some individuals simply ignore medical opinion and eat what they are used to. 2. Medical specialization, or you call it specialized medicine. Although medical students are exposed to the general field of medicine, nevertheless, the major weakness or limitation of medical science is that it is broken into parts where doctors specialize in specific health problems of the human body. Hence, there are eye specialists, ear specialists, heart specialists, or cardiologists, bone specialists, blood specialist, cancer specialist, oncologist, urologist, dentist, and so forth. Medical specialists generally offer services in their areas of expertise or specialization. The belief is that specialization is likely to contribute more to the level of expertise in the treatment of health problems or maladies. Unfortunately, contrary to specialization, the human body operates as a total system where the blood circulates around the whole body. Thus, if an individual suffers from 2 or 3 medical problems, he or she is likely to see 3 specialists. Each specialist might provide drugs to treat his or her area of specialization without necessarily paying much attention to the other parts of the body. A particular specialist might suggest certain foods, and another specialist might suggest different kinds of foods. This puts the patient in a confusing situation. Another problem is that the drugs taken to solve an ear infection could end up causing problems to the heart, kidney, and or liver. In other words, different drugs have different effects on the body, thereby weakening the immune system due to the stress caused by the medications. Why? Because the body operates as a total system and is not segmented the way scientific medicine is segmented into different specializations. Thus, the segmentation of medicine into specializations contribute to health problems caused by pharmaceutical drugs. The reason is that a doctor might concentrate on treating his or her area of specialization and ignore the fact that the drugs could be causing problems in other parts of the body because the body operates as a total system. 3. Standardization. Both health and medical sciences put undue emphasis on physical characteristics of health and generally ignore the immaterial, intangible qualities of human health. Hence, there is a tendency toward standardization, quantification, and measurement in healthcare services. And this sometimes creates a complex situation. There are many ways to look at it. For instance, A. Standardization. In order to allow for critical observation, experimentation, testing, measurement, and determine correlation between variables, the entire medical field is standardized. 1. Medical procedures are standardized. 2. Disease symptoms are classified as standardized. 3. Treatment methods are standardized. 4. Drugs to be taken are standardized. 5. Foods to be eaten for good health are standardized. 6. The quantity of food to be eaten for good health is standardized. 7. Fruits and vegetables are generally considered the most suitable or appropriate food for good health. Therefore, there is a tendency to discourage the consumption of red meat and eggs. Now, let's look at the problems associated with standardization. 1. Nature does not seem to support the scientific medical view which standardizes a preference for fruits and vegetables over protein, especially red meat and eggs. 2. In the natural world, types of foods are determined by their physical environments. Thus, people eat foods that are available in their environment. It is impossible to live in Alaska and eat food that is in the Middle East and vice versa. The only way to do so is to import them at a high cost. It is not possible to live in the temperate zone and rely on tropical foods as staples and vice versa. Some people rely greatly on meat as a source of food while others rely on fish, depending on the environment they find themselves. For instance, the Samis in Northern Europe and the Mongolians in Eurasia raise reindeer. They consume meat products produced from the reindeer meat. The Mongolians raise both cattle and reindeer. Tibetans raise and rely on the yak as a source of protein and dairy products as a staple food. The Maasai consume meat and meat-related products as staple foods. Here, you see on the left the Mongolian reindeer herds. So in Mongolia, some of the herders raise reindeer, while some raise cow. On the right, you have the Tibetans. What do they raise? Yak. See, the yak is different from the cow and is different from reindeer. So here again, the people deal with the animal that is in their environment. Here you have a Sami, that is the indigenous groups that live in Northern Europe. They also raise reindeer, you see. On the other hand, look at the Maasai on the right. They raise cow. Again, what does that say? That people all over the world rely on what exists in their environment. So for the Maasai, they deal with cows. For the Sami, they raise reindeer. And they use these animals as a major source of food. So when a medical doctor says, oh, red meat will do this, red meat will do that, if that had been the case, then all the Sami people now would have developed serious medical problems. The same thing with the Maasai, the same thing with the Mongolians, the same thing with the Tibetans. But that is not the case. 3. Nature has a way of conditioning all living organisms to adjust to their environments. This means that people who live in a particular environment might be able to consume certain foods that might cause inflammation to people who live in another environment. Those who live in an environment that rely more on meat products might not be comfortable eating extensive vegetables that could cause digestive ailments for them and vice versa. That is how the natural world works. Therefore, the Mediterranean diet is most suitable for people who live in the Mediterranean region and not necessary for the entire world. So when health specialists say eat Mediterranean diet, they are not being reflective of the fact that in every region of the world, there are certain foods, and the people who live in those regions eat what they have. Generally, people who live in the temperate zones rely extensively on wheat, barley, rye, rice, and dairy products as staple foods. On the other hand, those who live in the tropical zones have more food options than those who live in the temperate zones. So those who live in the tropics have so many foods, so many fruits that they eat a combination of foods at any moment in time. Unfortunately, most health and medical scientists tend to focus on food products obtainable from the temperate zones of the world and ignore food products from the tropical zones of the world when making food recommendations to their clients and patients. Most times they don't even think that there are foods in the tropics. 4. Quantification. Since health and medical sciences are part of science, they operate based on the parameters of science. Hence, they tend to quantify health and food. 1. They want to know how many times must a drug be taken a day. 2. How many times should food be eaten in a day? 3. What quantity of food should be eaten at any one time? 4. What quantity of water must be drunk in a day? 5. What quantity of vitamins must be taken or consumed in a day? Everything is quantified by the scientific methodology of health and food. Now, let's look at the problems associated with quantification. A. The persistent attempt to quantify creates the impression that the human body is like an inflexible machine that does not adjust to the environment. B. The fact is that the human body is a living organism and readjusts or recalibrates to meet or reach or achieve a balance. See, if a person eats something sugary, the blood sugar level might go up, but after a while, the body will adjust to normalize the level, unless it is excessive. D. The quantity of food that each person consumes is based on the metabolic rate of each individual. This is why the same size of food cannot be applied to everyone as a general rule. In other words, don't give everybody the same size of food, assuming that that means good health. No, because people consume food based on their metabolic rate and how much the body can tolerate. Different people have different body mass, thereby necessitating different quantities of food consumption. In nature, people do not quantify what they eat. Generally, they stop eating when the body feels full. F. Even the quantity of water to be consumed daily is debatable. For instance, those who live in the desert regions of the world might not drink water as frequently as those who live in non-desert zones, yet they live healthy. The same applies to camels and other desert-dwelling creatures. G. The bear might not eat food for 6 months during the winter while in a state of hibernation, and still survives. 5. Measurement. In keeping with the scientific tradition, health and medical sciences are voracious in measuring everything that goes on in the fields. This is done to standardize, quantify, test, and determine relationships between variables, hence the desire to measure. There are many ways to look at this issue of measurement. A. Blood pressure must be measured to determine their levels. B. Blood sugar levels must be measured to determine the rate in the body. Now, let's look at the problems of measurement. Science demands the need to measure every health activity in order to determine relationships between drugs taken and recovery from a particular malady or inflammation, and between foods consumed and good health. Nature does not seem to operate exactly the way health and medical sciences seems to imply. Why? Because nature is a dynamic entity that contains complex web of variables that operate simultaneously in any given time that is beyond the capability of human beings to measure or test to determine correlations or relationships. Hence, people, animals, plants, and insects come in different colors, shapes, and sizes. See, this is why some people can smoke cigarettes throughout their lives without getting sick or catching cancer or liver disease, while some people might catch the dreaded diseases for smoking cigarettes. Some people develop high levels of blood sugar for eating bananas and other sugary fruits, while some people might eat the same foods without showing any signs of high blood sugar levels. 6. The rate of metabolism. While health science tends to standardize, quantify, test, and measure every health-related phenomenon or variable in order to rationalize and determine cause and effect relationships, nature does not work in that manner. Hence, contrary to the scientific assumption that as soon as one eats sugary substances or carbohydrates, the sugar level will jump up, nature seems to have a counterbalancing force to check the effect to a certain degree. The counterbalancing force is metabolism. A. People have different metabolic rates. Some people have high or faster metabolism, while some people have low or slower metabolism. This means that some people burn energy or carbohydrates much faster, thereby requiring the need to eat more. B, on the other hand, some people have low or slower metabolism, meaning that they must eat less since it takes longer for the body to burn the energy generated by the consumption of sugary foods or carbohydrates. Thus, an individual with a faster or high metabolic rate might not experience high blood sugar level at the same rate as an individual with a low or slower metabolic rate. This is why the same quantity of food cannot be prescribed to all because of the differences in metabolic rates. Due to the difference in metabolic rate, one person can drink a glass of liquor and become intoxicated, while another might drink 2 glasses and is not intoxicated. As a result, standardizing, quantifying, and measuring of food can lead to confusing outcomes due to differences in metabolic rates. Likewise, a particular drug might have different effects on two individuals depending on their metabolic rate as well as their degree of tolerability due to differences in body mass. It is this factor that makes the difference between being an alcoholic or a drug addict or not, in addition to genetics. In addition, the kind of occupation too affects the cause and effect relationships in eating carbohydrates or sugary foods. A person who does physical work like construction is likely to burn carbohydrates and proteins much faster than an individual who works in the office. Therefore, standardization, quantification, and measurement to establish correlations or relationships can be tricky for some individuals. 7. Reason and logic. Since health and medical sciences are part of science, it is predicated on the theory that every health and or medical event or situation has a rational explanation. This orientation reduces every phenomenon to their physical, material, tangible attributes. In other words, in science, there is no room for non-physical, immaterial, intangible explanation. Hence, through logical reasoning, any medical situation or event can be explained or managed effectively. Thus, health and medical scientists try to establish correlations or relationships between food and good health through logical reasoning, such as A. You eat sugary foods and the blood sugar level will jump up immediately. B. You consume a certain amount of salt, the blood pressure jumps up immediately. C. Consumption of carbohydrates increases blood sugar level. D. Frequent consumption of meat leads to bad cholesterol. E. Frequent consumption of eggs leads to bad cholesterol. F. Fruits and vegetables are the best foods for good health. Therefore, the best foods for good health is a diet made of mostly fruits and vegetables. In particular, the Mediterranean diet is recommended as the most suitable for good health. Hence, people must be encouraged to eat foods based on the Mediterranean diet. Other foods must be eaten sparingly to avoid inflammation due to their negative effects on the body. This is the way health and medical scientists tends to assume about the relationship between food and good health. Now, let's look at the problems associated with reason and logic. Nature does not operate strictly based on reason and logic. And there are many ways to look at it. A, for instance, luck or fortune can affect anyone either positively or negatively. Thus, there is no reason and logic in the occurrence of luck or fortune or bad luck or bad fortune. It is beyond scientific control. It just happens. B, biologically, some people are more comfortable eating fruits and vegetables. C, some people are more attuned biologically to eating protein-rich diets. Thus, they eat meat and eggs with little or no negative effect. I've already mentioned the Maasai, the Sami, the Mongolians, the Tibetans that rely on meat products almost all their lives. D, some people cannot consume eggs and milk-based products because their bodies cannot tolerate such foods. E, some people smoke cigarettes and cigars throughout their adult lives without suffering any major negative effect on the body. F, on the other hand, some smokers suffer complicated medical conditions like cancer, kidney, and lung problems, as stated earlier. G, some people die in the hospital and then come back to life, known as near-death experience, while some die and never come back to life. H, Asians have eaten rice as a staple for centuries, yet they are not all suffering from diabetes or high blood sugar level problems. Because if you were to apply scientific logic to Asians eating rice all the time, then almost all of them would develop medical problems. But if you go to Japan, the Japanese live for a very long time. You go to Vietnam, you have the same thing. So the reason and logic of science does not necessarily apply to science, to nature. Nature has a way of contradicting human reasoning and logic by conditioning living organisms to adjust to their environments, thereby neutralizing the cause and effect of scientific reasoning. For instance, the Moken people who live on water like nomads around Thailand and Myanmar in Southeast Asia spend most of their time freediving to catch fish. Scientists have discovered that their bodies have adjusted so well to deep free diving that they can stay much longer in the water before coming up to breathe. Hence, they have developed skills like fish to cope with their lifestyle. This is the Moken people, you see. They live on houseboats and they travel from river to river. They basically live on the water in their houseboats. And they constantly dive into the water to catch fish, you see. And because they have done it for long, for centuries, they almost begin to act like fish to a certain degree. In other words, nature has molded them in such a way that they can accomplish that without developing medical problems. So that is the wonder of nature. Nature can condition living organisms to survive their environments. And that kind of thinking is beyond scientific reasoning. 8. Contradictory results of experiments and testing. Many treatment methods are developed through experimentation and testing to determine their efficacy. Many drugs are developed and released for human consumption after going through experimentation and testing to determine their usefulness in addressing certain inflammatory conditions in the body as well as their negative side effects. After the testing, the government is expected to give a seal of approval before being distributed to the public for consumption. Now, let's look at the problems associated with experiments and testing in science. A. Nature again is very complex and dynamic, where several variables can act and react in a simultaneous manner in such a way that human beings cannot capture them in a scientific experiment or testing. B. Due to the complexity and dynamism, even when health scientists conduct experiments and tests using the same variables and control, they sometimes end up with different results. Hence, medical doctors, health scientists provide contradictory and confusing information about what food is good for health. And there are ways to look at it. A. Some scientific studies and experiments indicate that coffee, red meat, egg, fat, cloves, banana, and so forth are good for health. B. Other scientific studies and experiments indicate that coffee, red meat, egg, fat, cloves, banana, and so forth are not good for health. So which is which? C. Some scientific studies and experiments indicate that fruits and vegetables are the best foods for good health. D. Other scientific studies and experiments indicate that caution should be exercised in consuming fruits and vegetables. Thus, the scientific community is at war with itself because doctors doggedly take positions and stand by what they believe to be the right combination of foods for good health. The contradiction and confusion creates serious headache for patients who are not sure what to eat anymore. E. Conducting experiments and or tests can be very expensive. This contributes to the reason why the same experiments or tests can produce different results even if the same variables are used. Sometimes the controls are relaxed to achieve a predetermined outcome. 9. Science and genetically modified organism foods, that is the GMO foods. Science and genetically modified organisms are basically organisms in which their DNAs have been modified through laboratory experimentation. While GMOs have resulted in mass production of food to feed billions of people in the world, there are increasingly sources of many complicated medical maladies. To avoid being afflicted with one of the complicated medical maladies, people are being advised by health specialists to eat organic foods and avoid scientifically produced GMO foods. Thus, natural foods are the best for human health. It is ironic that while health and medical scientists are trying to educate or inform their clients about the right kinds of foods to consume in order to reduce inflammation and diseases, another group of scientists are busy producing GMOs that might negatively impact the health of people. Thus, people are caught between medical scientists and agricultural scientists who are busy producing agricultural products that might negatively impact human health. 10. Mass processed foods. Due to scientific innovation, mass-scale industrial production of food is now possible. As a result, millions, if not billions of people are able to eat without necessarily farming to do so. The drawback to the mass-scale production of food is that all kinds of chemicals are added to boost the quantity, freshen the quality, make them durable and attractive. The additives are contributing to diabetes, all kinds of cancers, heart, liver, and kidney problems, and other complicated diseases. So, mass-produced industrial foods, while feeding billions of people in the world, are also contributing to all kinds of complicated maladies. Here again, there is a kind of war between health medical scientists and food scientists. While medical doctors advise their patients to eat nourishing foods, especially fruits and vegetables, food scientists are busy producing very salty and sugary processed industrial foods that create all kinds of medical problems for people. Increasingly, health and medical scientists advise their clients to eat organic foods and avoid industrially processed foods that contribute to overweight, high blood pressure, high sugar levels, all kinds of cancers, and so forth. The problem is that organic foods are very expensive for most people to indulge in, especially in the advanced countries. Surprisingly, it is mostly people in the developing countries that consume organic foods. What a big surprise! That those who live in less developed countries are the ones eating the real food, while those who live in the advanced countries are eating mass-produced industrial foods that causes a lot of medical problems. 11. Scientific drugs. Scientific drugs have contributed to the advancement of medical science and the enhancement of the quality of life in the world. Science has made people to live longer. However, the drawback to scientific medicine is that the drugs have devastating side effects on millions of people in the world. And there are many examples to cite from. A. Prescription drugs contribute to high rate of drug addiction. B. Many drugs are produced to solve specific health problems, but the human body operates as a total system. As a result, a particular drug may cure a particular medical condition and contribute to other medical problems. Some of the drugs cause heart, liver, and kidney problems. They even cause stroke. C. Apart from the negative side effects that can cause serious health problems, the cost of scientific drugs are unbearable for most people in the world. Quite often, it is necessary to have insurance, call it medical or health insurance, in order to access some of the most expensive drugs. D. In many cases, people are expected to take some drugs for their entire life. That requires spending massively to purchase drugs. Some people go bankrupt because of the high cost of drugs, except the government subsidizes the cost. So that is a major problem in scientific medicine. The cost is unbearable for most people. 12. Science versus nature. Due to excessive reliance on physical knowledge of nature, while nature has both physical and immaterial, intangible, spiritual qualities. Science provides contradictory and confusing information about what food is good for health. And there are many examples to show. For instance, A, some scientific studies say that certain foods are good for health. B, other scientific studies indicate that the same foods are not necessarily good for health. C, science tries to globalize the Mediterranean diet as the best foods for good health. This is undue generalization. Why? Because, contrary to the scientific view of the best foods for human health, nature conditions people and other living organisms to eat foods that exist in their physical environments. This means that there is no single best diet for good health in the world. Nature also conditions human beings and other living organisms to adjust and be able to consume foods that are available in their environments. Therefore, it is a stretch of the scientific imagination to suggest a Mediterranean diet to someone who lives in the tropics or in the Arctic region of the world. In conclusion to this presentation, the following observations are made. 1. Science is limited to the study and application of physical, tangible, material quality of human beings and other animals. 2. Its effort to standardize, quantify, test, and measure to show correlation or relationship between food and good health is incompatible with the order of the natural world. 3. Suggestions by health and medical experts on foods that contribute to good health are contradictory and confusing. 4. Scientific reasoning based on logic about the relationship between types of foods that are likely to contribute to good health fails to take into consideration the fact that nature is much more complex than human reasoning. 5. Hence, nature conditions people to adapt and eat foods that are available in their environment. 6. Thus, the Maasai, Sami, the Tibetan, and Mongolian herders rely mostly on meat products as food because nature has conditioned them to rely on such diets. 7. Some people are conditioned by nature to consume mostly fruit and vegetable diets. 8. Some people are conditioned by nature to eat both meat and vegetable diets. 9. The Moken people who spend most of their lives on water have been conditioned by nature to free dive and stay longer like fish in the water. 10. The specialized nature of medicine contributes to the contradiction and confusion concerning what food is good for good health. 11. Hence, some health and medical experts say that coffee, red meat, egg, fat, cloves, banana, and so forth are good for health, while others say that they are not necessarily good for health. 12. The need to standardize, quantify, and measure the size, portion, and content of food before consumption is not a common facet of life. Therefore, it is very difficult to keep up. Now, let's look at some suggestions that have been made here. 1. The World Health Organization and other major international health science organizations should organize a global conference on the relationship between food and good health. In the conference, they should develop workshops that enable health and medical scientists to familiarize themselves with foods from different parts of the world, particularly those from the temperate and tropical zones. The conference should help to reduce the contradictions and confusion created by divergent medical opinions about what foods are good for health or not. 2. Health and medical scientists should lead the effort to lobby agricultural and food scientists to stop producing GMO, salty and sugary mass-processed food products for public consumption. 3. Medical scientists must put pressure on medical and insurance industries to lessen the cost of health services. 4. The World Health Organization must extend recognition to traditional, herbal, shamanic, and holistic medicines and not limit itself to recognizing and supporting only scientific medicine, because millions of people in the world rely on these methodologies and not on scientific medicine, because scientific medicine is too expensive. 5. The WHO should consult with China to develop a framework for coordinating these medical methodologies. Why? Because the Chinese have developed both scientific and non-scientific medical systems. This is important because the World Health Organization cannot claim to represent the world and yet concentrates its resources only on scientific medicine. Because millions, if not billions of people utilize traditional, shamanic, herbal, and spiritual medicine for their healthcare needs because they do not have the financial wherewithal to access scientific medicine. So the World Health Organization, if you really care about the world, then look at other methods of health and medical treatment. Thank you for listening to this presentation. Although it is very long, nevertheless, I believe it is very informative. Please subscribe to the channel. There are so many other interesting topics on the Knowledge Seeker channel. Again, thank you very much.